Here's a photo of a patient open wide. They can open 50 millimeters, and that's normal. Remember, 3 fingers between the teeth when you open wide is normal. If there's a problem with that, then you've got a problem with the jaw. The next photo shows you need to move the jaw to the side 10 to 12 millimeters. 10 to 12 that way, 10 to 12 that way, just like the photo shows. And we measure with a ruler when the patient comes in to see what's going on. As I mentioned too, the patient is supposed to open straight, like this. They're not supposed to go off to one side. And here you can see the patient's jaw going off to one side. We actually measure that in the office to see how much is off. And then when we fix the temporomandibular joint with our splint therapy, we notice the range of motion returns to normal. So it's very important to check for normal range of motion, because if there's a problem with range of motion, there's a problem within the temporomandibular joint. It's very important to check the muscles of the head and neck, because that's where most of the pain seems to be, the muscle of the head and neck. And so what we want to do, if we want to find out, we press on the muscles like this. There's a big chart of all the muscles of the head and neck we check. We press on the muscles. There's either no pain, slight pain, moderate pain, or severe pain. And we press on those muscles and record everything. And if the patient's clenching and grinding all night, you're going to find the muscles are extremely sore. But this will help when we treat the patient. We can go back and check on the muscles again and say the temporalis muscle here and the masseter muscle here is really sore. And after you put the night appliance in there, you relax those muscles, the muscle is not nearly as sore. And you know the patient's getting better if the muscles are not as sore as the beginning of treatment. Here's a picture of the temporalis muscle, which goes on the temple area. And that's where a lot of the headaches occur, right here. And that, what you can do is just put your fingers right here and clench hard. When I clench hard there, I can feel that muscle contracting and getting harder. Also put your hands on the masseter. There's the masseter muscle, which is in the cheek area. Okay, and put your fingers on the masseter muscle and clench hard. Feel that muscle get hard? So you can see, if in the morning you wake up and you got a headache here and you got a stiff or sore muscle here, you know you're clenching all night. Plus the other key is you wake up with headaches. Very important. If you're waking up with headaches and this hurts, you're probably clenching and grinding all night. Of course, you can look at the teeth also. If you're clenching and grinding, are the teeth worn down? Are you breaking any teeth? Are any teeth fracturing? Any teeth are loose? You can look for little wedge-shaped areas along the gum line. That's called abfractions. And are the teeth worn down? Are they shorter than normal? So you can check for clenching and grinding yourself, or ask your dentist to check. And if that's the problem, you need to wear a night appliance. And the night appliance is called a Ferrari 2, which prevents the back teeth from touching. Here's my associate doing a muscle palpation. So you can see he's checking the masseter muscle right here in the cheek, and he's checking, I think, the masseter muscle there as well. And there's a form down here we fill out. And here's all the muscles listed that we check on the right and left sides. And then after a few months, we would check those muscles again to see if our treatment is working. If our treatment's working, remember the muscle soreness gets less, sometimes goes away completely. I can remember one time I was treating a patient and I said, okay, now I have to check the muscles. She said, no, please don't check the muscles. The last time it was so sore. I said, I think this time will be better. Are you sure? I said, I'm sure, because you're wearing your night appliance and your symptoms, you tell me, are less. I think now the muscles will be less sore. And sure enough, when I was pressing on the muscles again, she said, I can't believe it. The soreness has gone away. I said, that's because our treatment is working.